Hello and good afternoon, everyone, and welcome to today's webinar session, the Executive Order, the Proposed Rules, and How to Prepare. It is 2 o'clock Eastern Time here, and I still see some people dialing in, so we're going to give everybody about another 30 seconds or a minute to get settled in, and we'll go ahead and get started. All right, we're going to go ahead and get started with today's session. Again, welcome everyone. Thanks for joining today. Just some brief introductions. My name is Brad Josephson. I'm the Director of Marketing here at PMMC. And with me joining today is Greg Kay, Senior Vice President at PMMC. And to start today's session, I'm going to go ahead and turn it over to Greg.
Great, thanks, Brad. So the Pricing Transparency Executive Order was just issued a few months ago, and CMS draft rules were posted shortly thereafter at the end of July. The comment period has ended, and right now there are still more questions than answers for most organizations. One thing we do know is that with this particular executive order, it is wide-reaching and will likely impact many areas of your organization, from administration to finance to revenue cycle to managed care to patient access. So Brad, I believe we're going to start today's session off with a poll question.
We are. Thanks, Greg. And today, to start today's session, we'd like to get an idea of the audience, or at least from the audience, where your organization is as far as your planning for the Executive Order Price Transparency Mandate. So far, what has your organization done to prepare for the mandate? And the options here are organized payer contracts for modeling, analyzed historical billing data for shoppable services, requested proposals for third-party vendors, contracted with a third-party vendor, or have not yet started preparing. And again, that question is, what's your organization done so far to prepare for the Executive Order mandate? And while we're getting those responses in, I'll just cover a couple of housekeeping items. Today's session is a 30-minute webinar. We are going to take a couple questions at the end, as many as we can get to. So if you do think of any, you can go ahead and enter them in the questions tab in your GoToWebinar pane. For those that we don't get to, we'll provide a written response after today's session. So it looks like the majority of the audience has responded to the poll question, and it looks like about half of today's audience hasn't even yet started preparing. So we'll be sharing some things you need to start thinking about over the next really 75 days in order to meet the proposed mandate.
Great, thanks, Brad. So with the goal of today's session, what we're going to do is provide you with an overview of the executive order and CMS's proposed rules, as well as key questions that your organization should be working through, plus key strategic steps that you should be taking to be prepared for the impact. The window of time is closing, as Brad mentioned. There's about 74 days left to hit the mandate target date of January 1st, 2020. Today, many healthcare executives that we speak to are still surprised with the requirement. And as a quick level set, it's important to remember that this has been a known requirement that really started back almost 10 years ago with the Affordable Care Act. It was updated with the Public Health Act that required each hospital to annually list their standard charges, including DRG code groups. And in 2015, CMS published the inpatient rules and reminded hospitals of their obligation to comply. CMS at the time encouraged hospitals to list charges and to take steps to encourage our hospital healthcare providers to really engage consumers in a very user-friendly fashion to communicate the charges so that consumers could really compare charges across the organization and to really understand the financial impact and financial liability of the services that they were contemplating obtaining from the hospital. As we know, last year, the inpatient rules for 2019, CMS reminded us again of the obligation to comply with the Public Health Act, and they updated the guidelines to begin publishing a list of charges annually, and that really kind of put us on that path for the January 1, 2019 date. And around this time last year, CMS also issued an FAQ with some additional clarifications of what needed to be provided in the file that we had to post that listed our charges, our standard list of prices. It's also important to remember that beyond this federal requirement, many states over the last 10 years have been taking steps to make pricing more transparent. In early 2000, California really kind of began the process requiring hospitals to submit their CDM file along with a list of the average charge with at least 25 common outpatient procedures. In 2012, Massachusetts followed, requiring insurers to provide, upon request, an estimated amount the patient would be responsible for, plus a requirement for hospitals to disclose the charge upon request as well. In 2015, Oregon followed and offered up pricing data for the top 100 outpatient and 50 common inpatient procedures with the median negotiated amount by hospital, including the patient paid amount, such as the deductible and copay. That information was posted out on the OregonHospitalGuide.org website that they provided and put up for the residents of the state of Oregon. In the most recent reg, CMS also called out the state of New Hampshire with some of the initiatives that they put in place to provide a statewide website. And CMS specifically noted some of the things that they've seen in terms of medical imaging procedures and the lower cost of care that's come from that level of transparency. So while the requirement to post the gross and negotiated charge at the charge code level may seem like a new requirement following the mandate from the executive order back on the 24th of June, it does feel like it's a very small window to comply, but if we really look at the situation through the lens of the public or the lens through the executive, legislative body and CMS, our industry has really been very slow to embrace the move to putting the patient first with pricing transparency. Now, there may be an additional mandate guideline issued or an FAQ similar to last year, but based upon a response that I received from CMS's hospital pricing team, I think we should all take into account that unless specifically there are additional changes, the rules as stated following the comment period should be viewed as the ones that are likely going to be moved forward here in November. Brad, any other additional input as it relates to the poll question?
Yeah, we'll go ahead and share those results. I started speaking to them just a minute ago. So we'll get the full results out here, and then we'll compare it with how we've polled in the past. So about 50% have not started preparing, and this is on today's call. 14% have started organizing their payer contracts for modeling. Another 14% have analyzed historical billing data for shoppable services, and 14% have contracted with a third-party vendor to go ahead and put plans in motion. So how does this compare with how we've polled previously, Greg?
Well, it certainly matches up with similar responses back in September, as you can see online here. At that time, about 62% had not started preparing. About 6% had actually contracted with a third-party organization. And similar percentages were gathering information, organizing information to hit the mandate. When we look at a session we did with the New Jersey HFMA group in Atlantic City a couple of weeks ago, similar results. I think we're trending around 50 to 70% of organizations really haven't started, but most are starting to really realize that this is something we're going to have to move forward with.
Yeah, and when CMS published the proposed 2020 rules, it included the additional requirements to meet the President's executive order to increase price transparency and promote those policies that encourage choice and competition. So typically the OPPS rules are published in late August, but this year they were posted a little bit earlier in late July to provide that additional time to prepare for the January 1st deadline. And standard to the process, there was a comment period that actually just ended September 27th. And we'll take a little bit of a look here at the comments that were submitted. At that time, there were over 1,000 comments that actually had very significant support for increased price transparency. The comments, the positive comments at least, were largely from consumers and patient advocacy groups. Now, in reviewing the comments, the hospital opposition primarily related to the 340B reductions. More specific to the price transparency mandate, we saw that many of the state associations and individual hospitals expressed concerns about the effort and resources that were going to be needed to comply, and that the information may be more confusing than helpful. Now, some associations voiced support for the direction, while others expressed concern. It is interesting to note that America's health insurance plans expressed concern that the requirement may result in higher prices to consumers. This is similar to the wolf telling the shepherd, there's no reason to worry about the sheep because the wolf is here to help.
Yeah, right you are, Brad. It's important to also keep in mind that in the executive order that was signed back on the 24th of June, it also required within 180 days of the executive order that the Secretary of Health and Human Services, in consultation with the Attorney General and the FTC, will need to issue a report describing the manner in which the federal government and or the private sector may be impeding healthcare pricing and quality transparency for patients. And in that particular report, they're going to be providing recommendations for eliminating those impediments in a way that promotes greater competition. And the President also outlined that the report should also describe why, under the current conditions, lower-cost providers generally avoid healthcare advertising. So really, at the end of the day, based upon our review of the comments, there doesn't appear to be a compelling reason for CMS to delay the pricing transparency mandate and the assessment report, which will be delivered on or before Christmas Eve. So it's going to be singling out those barriers to pricing transparency. So we have to keep in mind we need to be moving forward with this because this is going to gain steam over the next several weeks and several months. We do recognize, I think like most people in the industry, similar to what Brad noted in terms of the comments, it is going to require a lot of effort. And yes, it might be confusing to some, but the consensus view really is that more information for patients to make well-informed decisions is better than less information. So at this particular point, every hospital really has a binary decision to make. Is this going to happen or not? Many organizations that we've spoken to have used the word hope, that the mandate will be delayed or overturned. But as we all know, hope is not a plan. So let's look at some steps that you should be taking as we move forward. So I think the first piece to just level set on is, who does it impact? Well, the current rules list out very clearly who will be included and who will be excluded. So when you really decide if your organization is going to move forward, CMS has really outlined 2 specific files that are going to be required. CMS has outlined you publishing your CDM file with all things chargeable, and that file including the gross charge as well as the payer-specific negotiated charge. And they've outlined publishing a list of 300 shoppable items that are going to be required. Now, as it relates to timing of that information, for planning purposes, if you elect to do this internally, you should estimate a minimum of 25 hours for every hour you spent last year posting your current list of standard prices on your website. Most organizations estimate somewhere between 100 and 200 hours were spent or invested last year to fulfill last year's mandate. Now, the second option is to do nothing, which does have some outlined penalties. If you're not compliant and you are reported, CMS will request your plan to be compliant. The current rules also outline specific fines and the fact that they're going to be providing a web page for the public that will list the hospitals that made a conscious decision to hide their pricing. Now, earlier this year, when CMS required hospitals to post a standard price list of items and services, most hospitals posted a file with a bare minimum set of data elements to be compliant. Most organizations listed their charge code, the description, and then the gross charge itself. For the upcoming mandate, CMS provided some additional guidance, in other words, to put the patient first, by making this data both useful and comparable. So in addition to the required items, we now need to be listing, along with the code and the description, the corresponding facility, the HCPCS or CPT code, the revenue code, other related data elements such as the NDC code or the modifier. And again, for those multi-facility organizations, it should be facility specific in terms of the codes with your CDM file. Now, as previously noted, CMS has also expanded the definition of charge to now mean the gross charge that we've listed back on 1/1/2019, along with the negotiated charge for all contracted payers and plans. Now, in this particular example, it highlights how your current posted CDM file should be expanded to include the noted data elements plus the negotiated charge for all payers and plans. So what we envision, based upon CMS's description, is you're going to have a CDM file that will have literally thousands of CDM charge codes, and you'll probably have somewhere between 20 and 100 plus payer plan code combinations that map out to the appropriate charge, where you're going to be listing both the gross charge and that negotiated charge. Now, the second file that CMS has listed as a requirement is a list of shoppable items. Now, CMS defines it as a service package that can be scheduled in advance. And that shoppable file, again, is going to need to include both the gross and the negotiated charge at the claim or account level, along with the detailed charges for those ancillary services. And that will include room and board, lab, radiology, meds, therapy, hospital fees, etc. To create the file, in our view, the first step is going to be to analyze your historical billing data to really determine an ideal claim or patient scenario for everything you do. and then determine, based upon those services, which shoppable items do you want to post. Now, CMS has provided a list of 70, and each hospital is going to have to come up with 230 items themselves. Now, CMS also provided some additional data around what needs to be included in that shoppable file. Again, they've outlined the code level information, similar to your CDM file, the machine readable format, and it's also important to note that this file needs to be available January 1st, and it needs to be updated at least annually, and you should be including a date stamp of the last update with those two particular files. Now, from an example standpoint, we again envision it being hospital specific. So if you're a multi-facility organization, you're going to need to list each facility, the corresponding service. Here we have a procedure code that would have billed out as a claim. You're going to have the gross charge, and underneath each ideal claim or scenario, you'll have the detailed charge that needs to be listed. So those detailed charges roll up to the claim level charge, and then you're going to have to go through an allocation process of drilling down from the negotiated rate that you have, the allowable, down to the negotiated charge for the computations. And again, that's going to have to be for every payer and every plan that you have an agreement in place with. Now, CMS did provide, through the most recent reg, a list of 70 shoppable items. If you do not have this list in an Excel file format, email Brad. We'd be happy to send it out to you, just as a quick reference. They broke services down into really 4 different categories: E&M services, lab services, radiology services, and then sort of an all other that included several inpatient scenarios as well as surgical and diagnostic procedures, making up that list of 70 shoppable items. Now, similar to CMS's guidelines, with the additional data elements that need to be in the list of standard prices, CMS also provided additional guidance with where and how this information needs to be made available. It can't be hidden or buried on your website, but CMS has defined that it needs to be displayed prominently. It also can't have various requirements to get to the data. It needs to be easily accessed, and it needs to be found easily and available without barriers. I think CMS found that many organizations did have their current files buried on the website. Many organizations incorporated different requirements, such as a username or password, email address. Those things are going to have to go away, just so it's really easy for the patient to get to the information they need.
Yeah, thanks, Greg. And that was really, I thought, good insight into the into the files and data that every hospital will need to be posting to meet the January 1st deadline. I do want to take it back a step for a second, though, and just make a comment that if we truly believe this is about putting the patient first and really providing pricing transparency, we really need to keep in mind the commentary we got from both patients and other industry associations that what patients really want is the ability to price shop and compare costs when they're seeking out their healthcare services. And that can be in the form of an easy-to-use tool that can quickly and accurately give the patient an estimate of their out-of-pocket financial responsibility. Now, the migration to price transparency is definitely a disruptive process, right? This isn't going to happen overnight. But seeing where this is all going over the last 2 years, I don't think either of us would be surprised that something like this would be potentially the next mandate around providing exact costs for estimates. And regardless of whether it is or not, there's going to be an evolution of this as far as who are going to be the winners and losers in this whole process. So those that do embrace change and really start putting the patient first and providing the information that they're really seeking out are going to be the ones that thrive and grow. So really the reality is that consumers want to be able to go online quickly and easily and quickly find the price and cost of their services at your facility. CMS is encouraging payers and providers and data aggregators to really step up to the plate and go above and beyond and really start developing and deploying API tools for consumers to quickly shop and compare. And then this also means, which you see in the last shot there, the ability for combined estimates, which provide the patients both technical and professional services whenever possible.
So what we've outlined today are really specific tactical steps or tasks that you must do to be compliant with the coming mandate. But really to win going forward with pricing transparency, you have to adapt, you have to be strategic, you have to have a plan that you work and you're willing to update the plan as you move forward.
Yeah, and just looking at some of the top issues for executives that are going on as we approach 2020. Last year, data and analytics were the top concern of executives, and this year, transparency has moved right to the top of the list. That's now the #1 issue as we look into the year 2020. And really, and I think this is a great quote here, it shouldn't be surprising that cost and transparency is at the top of the list along with the consumer experience. And I think it's going to be important as we continue to evolve in this is to start thinking about how we integrate data and analytics into price transparency moving forward.
Yeah, right you are, Brad. It's important to really recognize key processes that operate as organizational silos that are going to have to work together going forward. Not just reporting to the same executive, but actually starting to operate through an integrated platform. An accurate allowable is really the connecting component that's specifically where PMMC excels. Payer scorecards, financial reporting must integrate to really understand not just denials and contractual short pays, but how are we collecting from the patient and the payer? And how do we take into consideration when we negotiate the payer contracts? And how do we actually monitor our actual results to the projected results as we're working through the negotiation process? And how do we adjust charges and now reimbursement, or if you will, the negotiated charge as the market, being consumers, payers, advocacy groups, really understand and see how we compare to others. We're going to have new data that we're going to have to incorporate into the process like never before. Now, one of the things that we have shared with client organizations is the means to not only hit the task, but really develop a pricing strategy. And with our strategy, we've outlined really 3 different components to help you meet the end goal. The first step is to just meet the baseline requirement. And we've got about 70 some odd days left, so we're going to have to go through a process in a very deliberate way to create the 2 files that are needed, the CDM file and the shoppable file, and have that data available for clients to post to their website. And that's just to meet the mandate. For those organizations that are wanting to go one step beyond that, which is where I think most organizations are going to be heading, and that is no sooner than you post your information and are in compliant on January 1st, you're going to want to start to really analyze, aggregate, and compare how do your charges, being both the gross charge and the negotiated charge, compare to your competitor, and how do you make adjustments and take into consideration that data as you move forward with your payer scorecards, your payer negotiations, your payer contract management process. And then the last step that Brad touched on is really preparing for the next mandate, which we see coming next year, and that is deploying a true self-service patient out-of-pocket cost estimation tool that integrates in with the other components.
Yeah, and just some closing thoughts. And, what we really outlined today are some specific tactical steps that you just have to do to be compliant come January 1st. But what we really need to start thinking about is to really win going forward with pricing transparency, you have to be willing to adopt, and you have to be strategic. You really have to have a plan in place that you're going to work, and then be willing to update that plan as needed going forward. So what we really recommend doing, and what we're going to be offering today for everybody on the call, is a whiteboard session that starts defining what price transparency really means to you and what it means to your specific organization, because it's going to be a little bit different for everybody. All related departments should be aligned, starting with the executive team all the way down. And then once you have a definition in place, what we see is that successful organizations really start to identify what outcomes they want to see as a result of that definition. PMMC can help you accomplish this and then start helping you identify some current processes and gaps that really lead to KPIs that support your defined goals and objectives, so that way you can really start measuring success. And again, this whiteboard session is complimentary to everybody on the call today, and I'll send out a meeting link to my calendar if you'd like to go ahead and schedule some time.
Yeah, as noted earlier, we can view this through the lens of doing random steps for pricing transparency, or really do it as a part of a broader plan, a broader strategy. And a few just kind of closing thoughts as it relates to checklists. The first thing that most organizations need to ensure they have in place is a pricing transparency governance committee. We recommend the CFO, the contract management team, your compliance team, your back-end revenue cycle leader, your marketing team, and patient access be a part of that internal pricing transparency governance group. You should be monitoring CMS routinely for updates and commentary around the questions that have been posted. You should be looking and identifying all of your payer contracts. You should be conducting a review of your insurance master to ensure that you've got all of the identified negotiated payer contract as well as plans associated with them. And then you should be incorporating some processes to analyze the list of 70 services that CMS has identified that you're going to need to list as shoppable, and begin a process for determining how are you going to come up with your 230 services that also need to be added. The other piece to begin a checklist around is from a technology standpoint. As I mentioned with the process, you're going to need to confirm your ability to provide those shoppable service items, along with all of the corresponding detail that CMS has outlined, both at the code level, the payer level, the charge level, the service level, what file format are you going to be providing the information, incorporating follow-up discussions with your web team, with where that's going to be listed, and making adjustments to your website so that the information is very easily accessible to consumers. And lastly, looking at from a communication and education standpoint, the information that you're putting out, do you have a phone number? Are you going to use a chat functionality? How are you going to be tracking those hits, if you will? You should be creating an FAQ for both your front-end patient access staff, as well as any online questions that are coming in. How are those going to be handled? Updating your board with what's going on, as well as all the key stakeholders in the revenue cycle that may receive questions. We have a follow-up webinar that's going to be scheduled for October 30th Brad will be sending out some additional information. We're going to go into more detail around this readiness checklist, so we'll be doing a deeper dive in the coming days. There'll also be some additional sessions in November and early December, just helping our clients kind of guide them through the process, just to be sure that everyone is prepared, ready for this, because as we see it today, the mandate, we really just don't see any reason why the mandate's not going to stand as is. Obviously, I think everyone hopes there will be some reason for it not to come to fruition, but at this particular point, we have to plan and continue to move forward just as if it will be final.
Thanks, Greg, and thank you, everyone, for spending an extra 5 minutes with us. I know we ran a little bit over. We had a lot to cover. We'll stay on the line for anybody that wants to stay for a couple of questions. If you need to run, feel free to email us with any questions you have, and we'll be sure to reconnect with you shortly. So, Greg, I do have a couple of questions that popped up during the session. Does CMS expect us to list all charge items?
Yes. CMS is building on what they listed and required last year, which is to include all charge items for both services as well as pharmacy items, supplies, etc.
And does CMS expect us to publish Medicare and Medicaid?
Currently, CMS has indicated that Medicare and Medicaid does not need to be listed. They do not consider it to be a negotiated contract. So all of your payer contracts that you have negotiated rates and terms with are the ones that you need to list. If you have Medicare or Medicaid Advantage plans, you're obviously going to need to go through the exercise to compute your expected reimbursement and then have a process for allocating that down through a calculation, a weighted methodology of allocating the negotiated allowable down to that detailed charge code level.
And then one more here. If we bill for professional services, do those need to be posted as well?
Yes. So if you're billing through your technical services, your 837I, if you will, employed professionals such as your ED physician, psych, PT services, etc., you would want to list those items, especially if you have negotiated rates for those professional services.
And then I did get another question here. What about the trademark on CPT and HCPCS codes? Are we allowed to publish those?
You should be allowed to publish those. I would go back and check with your compliance department, your compliance team, what your contract with AMA allows. There may be some fees that you will need to provide to AMA to publish those, because if you are providing that as a reference, there are fees depending on how you have that set up within your organization.
Hey, and what about managed Medicaid?
So yeah, managed Medicaid, with those particular payers, you're going to have to publish the negotiated rate. Again, you're going to need to go through the exercise for both your CDM file and your shoppable services to compute the negotiated rate, especially for the shoppable items, at a claim level, and then allocate that allowable down to the detailed charge for all payers, including managed Medicaid.
And for procedures, are we required to list all the CPTs billed along with the main surgical code?
So yes, you're going to want for your surgical outpatient cases, your inpatient services, your diagnostic cases where you have multiple codes that are billed at a claim level, you're going to want to identify an ideal claim or case, if you will. You're going to need to calculate the expected reimbursement or allowable and then have a process to then allocate down to the detailed charge code level that value to the other codes that were billed on the record.
And then if you could confirm, negotiated rates are only required for the 300 codes, is that correct?
So the way CMS has defined it, in your CDM file, you're going to have to list your negotiated charge for every charge code and for every payer and every plan. And then for the shoppable services, it is only required for 300 shoppable items, where you'll need to list the negotiated charge at the claim level, and then allocate that negotiated charge down to the detailed charge code level for those services.
And here's another one. What can PMMC do to help us with this?
So yeah, probably the quickest thing would be to reach out, schedule a call with us. We can outline for you the steps to meet the mandate, what's required, how we go about getting the data. We obviously need historical billing data, a CDM file, along with your payer contracts to go through that calculation process, and then an allocation process to allocate the expected reimbursement down to that negotiated charge code level for all the services that you provide.
And I did just include a link to my calendar. If anybody on the call wants to go ahead and book some time with us, feel free. We'd love to keep talking with you about this. As always, we recorded today's session, and I will be sending out both a copy of the slides and a link to the recording within the next day or so. And please be on the lookout for our next session on October 30th. Thank you, Greg, and thank you everyone for joining us today.
Thanks, everyone.